Good morning to you and to all the comrades who are here with us every morning and who make this broadcast possible, including Gisela, though she's a little far from here, but she makes the introduction of the conference. And most importantly, good morning to all the people who follow us in different places in our country. Today we're going to give the information about what happened until yesterday at 12 o'clock at night. One comment, I was told that when there are no deaths to report, in spite of my drooping eyes, my eyes shine and they should be bright today as we have no deaths to report. We do not have deaths for a second day in a row, which is an expression not that we have solved everything, but that there is a better moment and a better recovery of our patients. In this way, we start the day with 913 patients admitted to our hospitals. This is also the lowest figure we have had over the last 2 weeks, less than 1,000 cases. In surveillance, we have 23 cases, 556 suspected, and 334 confirmed. In primary healthcare, we have 2,947 people being monitored for certain risks related to this disease. Yesterday, 2,232 samples were processed, 10 of which were positive. This makes a total of 77,374 samples processed in our country, of which 1,840 are positive. This represents that 22.4% of all the samples that have been studied in Cuba have tested positive. The 10 new confirmed cases were Cuban, as has been the case in recent days. 9 are contacts of confirmed cases, 90%, which is the most important risk group that we have. And I think that in the world, it is the risk group that brings the most positivity. There are 1,603 confirmed cases, 89.6% which have been previously confirmed case contacts. In one of the cases identified yesterday, it has not been possible to identify the source of infection. It is always a question of searching until we find that source, and I have explained here the reasons why we pursue this tracing to be able to do the actions necessary until the last place where a person might have been in contact with this confirmed case. With this confirmed case, 55 have accumulated in the entire epidemic, 3.05%, of which we have not been able to determine the source of infection. The figure remains the same as we have been given for the last 2 days now, with the number of people infected abroad at 131. That is 7.1% of the confirmed cases in Cuba. And yesterday we had no confirmed cases from abroad. Although restrictions are in place, we have reported here that there have been cases of migratory flow in our country, mainly related to Cubans who have found themselves stranded abroad after the measures were implemented in our country. Of the 10 newly diagnosed cases, 30% were male. Nonetheless, of the 1,840, male patients account for 51.2%. That is, 942 are male, a little bit higher than female individuals. Of the 10 cases, 7 are female, for a cumulative total of 898 female individuals who have contracted the disease, and this amounts to 48.8%. It is important to note that the 60% of the cases diagnosed yesterday were totally asymptomatic. If they had not been contact or part of other risk groups, people who are usually in isolation centers for contact, they would have not been detected unless they had any obvious symptom. In the Cuban epidemic, there are 907 confirmed people who have not had any symptoms at the time of the diagnosis, and this represents 49.2%. Of the 10 diagnosed cases, a total of 6, that is 60%, are under 40 years of age, and 4 who belong to the group of over 60 years of age. Yesterday, 3 children were diagnosed with the virus. All 3 of them were asymptomatic, and as we always explain, the 189 children who have already been diagnosed in Cuba have had a favorable evolution. 150 have already been discharged, and these children who were notified yesterday, 2 are 10 years old, and 1 is 3 years old, and from the municipality of Havana del Este here in Havana, and all contacts from a case that had already been confirmed. Of the 10 cases confirmed yesterday, 7 correspond to Havana and 3 to the province of Matanzas. Of the 1,840 patients diagnosed with the disease, 334 remain hospitalized. These are the cases we describe as active patients. Of them, 325, or 97.3% of the confirmed COVID-19 cases that are still admitted to our hospital units, they have a stable clinical course. Unfortunately, and we always regret when we talk about this, in Cuba, 79 people have died due to COVID, and this gives a lethality of 4.3%. This situation, compared to the region of the Americas, we're not going to compare it with the rest of the world. The lethality in the region today stands at 6.2%. Ours is of 4.3%, which is why Cuba currently occupies the 14th place in the region among the 35 countries that make up the region. Of all these countries, 14 have a fatality rate above the average of the region, and among them we mention Mexico with a lethality of 10.5, Canada 7.34, Ecuador 7.66, Brazil 6.96, and the United States with a lethality rate of 6.05, and some countries of the Caribbean have high rates as well. As we always mention, we have the 2 people who were evacuated since that were reported at the beginning of the pandemic, and yesterday 42 people were discharged for a cumulative total of 1,425 patients of all the diagnosed cases in our country, which is 77.4% of them have recovered. So of all those patients admitted, 97.3% have a stable clinical evolution, and 77.4% of all confirmed cases in the country have been discharged and recovered. And I stress this because they are figures not to be these are figures not to be confident in the list, but one also needs to have a little encouragement in the evolution of the disease. The number of cases in critical and serious condition remains the same. 3 are in critical and 6 are in serious condition. Yesterday, from the migration point of view, there were no entries, but there were a total of 563 departures among Cubans who reside in the country, immigrants, crew members, and foreigners who were here as tourists. Currently, in Cuba, there are 5,845 Cubans who reside abroad and 4,142 foreigners, for a total of 9,987 visitors. No changes in rental houses. 936 foreigners, primarily in the municipalities of Santiago de Cuba, Plaza Centrovana, and Playa, as we have been reporting since the beginning of this briefing. Until the cutoff last night, the world reported increasing figures. The world remains with 184 countries with COVID-19 cases, for a total of 4,308,809 confirmed cases. In one single day, 85,762 more cases. In one single day, 5,161 people died as a result of COVID-19, for a cumulative total of 296,680 deaths in the world, for a lethality of 6.88%. And I stress that after the time of the evolution of the disease, already exceeding 4 months and a half, these are in fact very alarming figures. And since there are no signs yet that a reduction is forthcoming, the region of the Americas confirmed 44,213 cases yesterday, for a total of 1,889,851 cases confirmed, which represents 43.86% of the total number of cases reported in the world, and with 3,113 people who died yesterday, there is a cumulative total of 113,827 deaths, which, as we said earlier, gives a lethality of 6.02% of the cases of the region. And with this, we wrap up our briefing.